Why do different brain lesions cause specific speech issues? Imagine your brain as a busy city with many neighborhoods, each responsible for different jobs. When a part of this city gets damaged, only certain tasks are affected. That's why different brain lesions lead to specific speech problems. Each area of the brain controls a different aspect of talking, listening, and understanding. When that area is hurt, the problem shows up in a unique way. Speech production involves many parts of the brain working together. The motor cortex and cortical motor areas are like the city's traffic controllers for muscles involved in speech. They tell your lips, tongue, and vocal cords how to move. If these areas are damaged, it can cause apraxia of speech, which makes planning and coordinating speech movements difficult. People might struggle to start words or say sounds correctly. The somatosensory areas are like the city's feedback system. They tell your brain about the position and movement of your speech muscles. Damage here can make it hard to monitor and adjust speech, leading to errors or inconsistent speech sounds. Broca's area, located in the frontal lobe, is like the speech producer. It helps form words and keep speech fluent. When this area is damaged, it can cause non-fluent aphasia, where speech becomes slow, effortful, or halting. People understand language well but have trouble speaking smoothly. Wernicke's area, found in the temporal lobe, is like the language decoder. It helps understand what others say. Damage here results in fluent but often nonsensical speech, and people may not realize they are not making sense. Their comprehension is also affected. The basal ganglia and subcortical structures are like the city's traffic regulators for movement. They help control muscle strength and coordination. Damage to these areas can cause dysarthria, a motor speech disorder where speech sounds slurred or slow because of muscle weakness or incoordination. White matter pathways are like the roads connecting different neighborhoods. They carry messages between brain areas. When these pathways are damaged, communication between speech and language centers gets disrupted, causing problems with overall speech clarity. The location and size of a brain lesion determine what kind of speech issue appears. For example, damage to motor speech areas causes trouble planning and executing speech movements. Damage to language comprehension areas causes difficulty understanding or producing meaningful language. When motor control centers are affected, muscle weakness or incoordination can make speech slurred or slow. Damage to white matter pathways can interfere with how well different parts of the brain work together. From a speech therapy point of view, knowing where the damage is helps create the right treatment plan. If the problem is motor speech, therapy focuses on improving muscle control and speech planning. If it's language comprehension, therapy works on understanding and expressing ideas. The severity of the lesion also matters. Larger or more widespread damage usually leads to more significant speech difficulties. In clinical practice, brain imaging and detailed speech assessments help identify the specific problem. This way, speech pathologists can develop targeted exercises to improve speech clarity and communication. They might focus on strengthening muscles, practicing speech movements, or improving understanding, depending on the lesion location. In short, different brain lesions cause specific speech issues because each brain region has a special role in talking and understanding language. When that part is damaged, it disrupts its unique function, leading to the distinct speech problems we see in motor speech disorders and other communication challenges.